I'm Dr. Tyler Elmore, and I've had a couple of questions concerning neuropathy, so we just decided to do a video on peripheral neuropathy. So peripheral neuropathy is a disease of the peripheral nervous system, i.e. your feet, your toes, your legs, even your hands. And so what ends up happening with peripheral neuropathy is there is a myelin sheath that surrounds your nerves, and that myelin sheath acts as an insulator, but within that myelin sheath are blood vessels which supply nutrition to your nerves. And so in order for that myelin sheath to continue to be healthy, it's got to have nutrition. So with peripheral neuropathy, that myelin sheath begins to break down. So the nerves begin to die off because the blood flow is decreased. And when you have a decrease in blood flow, you don't get the nutrition that you need to those tissues. And so you get peripheral neuropathy. So peripheral neuropathy is one of the most common chronic conditions in the United States today. In fact, it is the number one chronic condition, or excuse me, the number one cause of peripheral neuropathy is actually type 2 diabetes, or diabetes in general. And one thing that happens with peripheral neuropathy is it is treated with medications. Problem you run into with medications is when they're involved, you are going to have side effects. And the medications that they treat peripheral neuropathy with are loaded with side effects. And so that is not a good long-term solution. What it's typically treated with is the gabapentin, the Neurontin, the Lyrica, the Cymbalta, all sorts of various pain medications. The problem we run into is they'll put you on a medication and it's going to work okay for a couple of weeks, couple of months. That medication is going to begin to lose its effect, so you're going to go back into your doctor. They're either going to up your medication, change medications, send you out the door again. A few months you're going to be back in there because you're experiencing symptoms again. They're either going to up your medications, they're going to change your medication, and you go through this cycle over and over and over again until eventually their recommendation is amputation, which is typically the end result of peripheral neuropathy. So what we want to do is we want to break this cycle and give you a new, fresh approach to treating peripheral neuropathy. So in our country, we don't have a healthcare system. We have a pain care or a disease care system. And what they're trying to do with this is they're trying to fit your chronic and autoimmune conditions into a disease care model. It doesn't work. It's never worked, and it's not going to work. And so what ends up happening is they're trying to force that medication model into a chronic and autoimmune model. And again, it doesn't work. Roughly 75% of the visits to doctors in this country are for chronic and autoimmune conditions. We also spend about $3 trillion a year combating these diseases. And the problem is they're continuing to get worse. So we know it's not a money issue. We have a treatment issue. We're not getting the right treatment for these types of conditions. And so what we need to do is change our approach. So the pharmaceutical industry, they spend roughly $5 billion a year marketing you these drugs that you have to take for the rest of your life. And surprise, they do not cure the problem. I always tell patients it's like driving down the road in your car and your oil light goes on. And you're looking around going, man, I don't have the time to get it fixed. I don't have the money to get it fixed. So you reach in your pocket and you pull out a Band-Aid and put it over that light. All right, sure enough, the light goes down, but you and I and everybody else knows that's not going to cure the problem. Eventually what happens to your car is the engine seizes up, the car dies, and that's the end of the car. Well, the same thing happens with our bodies. They're just a little bit more resilient. They typically take a little bit more time, but we can only put so many drugs and cover up so many side effects before that body ends up dying. So our job is we just want to give you a new, fresh approach to that. And there's no doubt that there's a time and a place for drugs. Emergent care is fantastic, but chronic and autoimmune care, it is not the best way to go. I'm going to give you a little bit of an analogy as far as a plant goes. I mean, if you've got a plant, what it needs to survive is you got to have soil, you got to have sunlight, you got to have nutrients, you got to have water. That plant can live. But if you take that plant away from sunlight and you don't give it water, ultimately what ends up happening is the plant withers up and can appear to die. But here's the beautiful thing about that plant is most of them, even though they appear to be dead, if you put them back in sunlight and you give them water and nutrients and you take care of them, those plants can miraculously come back to life. Well, the same thing happens with peripheral neuropathy and other chronic and autoimmune conditions. If you give that body what it needs, those conditions can start to disappear. So neuropathy generally takes about 5 to 10 years of real slow progression. And then eventually what ends up happening is it hits kind of a critical mass, and then it really starts to take hold, and it gets dramatically worse within a short period of time. And it gets to that point where sometimes these folks get so far gone that you can't be treated. And so peripheral neuropathy, again, is the #1 cause of amputations for the diabetic patient. And if you have peripheral neuropathy, basically up to this point, you've had 2 options. #1 is you can go to your medical doctor who's going to give you drugs, or you can go to a specialist who's going to run a bunch of special tests, and in all likelihood, he's going to give you the same drugs. So we want to change this treatment mentality. So you've probably had your doctor tell you that, hey, peripheral neuropathy is untreatable, it's a nerve issue, it's just going to run its course. And that's partially right, because with the way that you're being treated, it does just run its course. Our job is to change up that course, because absolutely that's wrong. You can treat peripheral neuropathy. Nerves can heal, nerves can get better. We've just got to help our body heal itself. So the third option is where we come into play, and that is where we really want to restore nerve function by taking just a completely different approach. Our approach here is an inside-out approach, and your body can absolutely heal itself. Just like that plant can be restored to normal form, your body can too. Our bodies have been given this God-given pharmacy in here, where our whole approach is if we can just get the insides working properly, give them what they need. They're smarter, they're more efficient than any medication, than any doctor out there. We've just got to get this internal pharmacy working properly. So if you're skeptical at this point, I completely understand that, but I want to ask you a couple of questions. #1 is, if you break your arm and it requires a doctor's visit, and you go into that clinic and you get a cast put on your arm, what heals up that arm? The cast or your body? Take another situation. If you get a cut and you require stitches, you go to your doctor and he puts stitches in that arm. What heals that up? Stitches or your body? Sometimes your body does need a little bit of help in the way of stitches or a cast, but absolutely your body is the one that heals that up. So I learned that in the personal realm. I got diagnosed with rheumatoid arthritis when I was 19 years old. And to give you the Cliff Notes version, because we already have that story recorded on our website, I'm not going to go into detail with that. But I also had 3 parasites, 13, 14 different bacterial infections, a heart murmur, rheumatic fever. They wanted to put me on chemo. They wanted to put me on a whole bunch of different medications. The doctor told me within a year, you're going to get your knees replaced. 3, you're in a wheelchair. 5, you're going to be dead. Don't ever plan on having kids. Don't ever plan on being athletic. That didn't sit too well with me. I'm too much of a competitor. So I started my research, and we started questioning those doctors on diet and nutrition. Not only did they laugh at the idea, they actually kind of got angry with it. And I just decided, hey, if you've got nothing better to offer me than 5 years, I think I'm going to go out on my own. So I ran into a medical doctor and a chiropractor who were really big into the inside-out approach. And needless to say, we dialed in that nutrition. It took about 4 years to kick it, but here I am, 45 years old, and we're still kicking. And so I don't say that we can treat every single solitary condition, because that's not what we focus on. We focus on the patient. We focus on that inside-out approach and just trust that that God-given pharmacy can take hold and do its job. And so, like with rheumatoid, lupus, irritable bowel, any of those conditions, peripheral neuropathy also requires a multifaceted approach. So here in our clinic, we use light therapy. There's a certain light therapy that promotes angiogenesis, which is the production of new blood vessels. We also use an electrical current that is used at the Cancer Center Treatments of America for their peripheral neuropathy patients, and it is designed to actually stimulate the growth of new nerves. And then we also have nutritional products or nutritional programs that we utilize in conjunction with the therapies. So we got the vessels being regenerated, we've got the nerves being regenerated, we're providing them with the nutrition that they need, and our patients do fantastic with this approach. And so one of the big things that people forget about neuropathy, it is primarily a nutritional issue. If you can't get the nutrition into the tissues that you need, it's not going to work. And so nutrition is utmost important with that. So if you've got any of the following symptoms, feel free to give us a call. But if you're experiencing the numbness, the burning, the cramping, the sharp or electrical kind of feelings, the tingling, balance issues, which is ultimately what neuropathy leads to, give us a call, 801-774-7541. We will go through and we will take a thorough history. We'll go through an exam. We'll actually let you know what percentage of sensory loss you have on each foot, each hand, whatever the case may be. But we would love to have you come. We'd love to check you out.